Hi, I'm Nish from YB Aligned. Welcome to Movement Monday, and today we're going to be looking at the knees. We are going to be looking at different ranges of movement available to the knee, how we can encourage those movements, and also some myths like should we stop our knees from going over our toes? So stay tuned. The first movement we have is our sagittal or side-on plane, and it's our flexion and extension. This simply means bending of the knee joint and opening. Now, what is interesting to note, a lot of people think of this as just the bones collapsing towards each other or sort of opening at the front. However, you can see here, as opposed to an open and close, it's a glide movement within the knee joint. The next movement is in our rotational or transverse plane. This is actually a static image, but you can see the femur or the thigh bone and then the lower leg bones and those little nodules in between them. When I say nodules, I mean little grooves. In between our knees, we have these pads of cartilage called our meniscus or menisci. And you can see them here. They have a round shape. I want you to bear that in mind when we're talking about the next movement, which is our rotation. To get the movement in our transverse or rotational plane, think about those grooves we saw, those two meniscus. What's happening is either our thigh bone is moving or our lower leg bones are moving, or they're moving away from each other. And those little grooves, we have got getting rotation within those grooves. So instead of moving the whole leg as one, we are getting movement, just the lower leg is moving separate to the upper leg. And that's going to look like this. Whole leg rotating in and out. Lower leg rotating in and out. So before we go over some practices that are going to help encourage those movements back into the body, let's quickly discuss a couple of knee myths. The first is the very popular, your knees shouldn't go over your toes. And what I mean by this is if you're side on, if your toes are here, your knee shouldn't bend forward of those toes. Now, unpopular opinion, I'm here to say that anatomically, if you have the ability to do that, then fundamentally that movement cannot be bad. There were several studies done years ago that were looking at the ACL and how easy it is to hurt your knees. And they found that they thought this was one of the lead causes. However, I'm here to say that I believe it's to do with your alignment above, how your feet and ankles move, whether they do or don't, and also load bearing. All of these things have to be taken into account, but the principal movement of letting your knees bend over your toes is not bad. Our bodies are designed to do it, so it cannot be a bad movement. Myth number 2 is that the knee should always be going straight ahead. It's not allowed to go inwards or outwards. Now, again, you just saw there that my body has the ability to do that. So in my opinion, fundamentally, it cannot be a bad movement. However, it often tends to occur in emergency or accident situations, such as if we trip on a pavement or if you're football player going in for a tackle, your knee goes off at a funny angle. The joints, the muscles, the tendons, the cartilage weren't prepared for the movement, and often that's why it will cause an injury. If we can learn to glide into these movements safely and come out of them, then the joint will be prepared for that movement if it needs to access it at a later date. So I believe that some knee coming over the big toe or coming in towards the inside of the foot and rotation with it is actually a good idea to prepare your knee to experience that movement as and when it needs to. Now we know what our knees can do and that we're safe to access these movements. Let's do some practices to get some movement into those knee joints. For our flexion and extension of the knee, that's our bending side on. If you've had knee pain or perhaps knee surgery, there is a seated option I'll show you in a moment. Otherwise, if you want to be standing, I want you to have your feet a natural footstep apart and try and think about your upper body staying stacked over your pelvis. Don't lean forward during this. So you're going to simply think about that gliding movement of the bones in the knee, and you're going to let the thigh bone send forwards and think about that knee gliding. And you can see here, I've now come over my toe, but my knee is prepared to do this movement. You might want to start smaller at first, just here. We're letting some of our weight in our body load into that knee, and then slowly and gently you can increase this movement over time. And for a seated option, you're going to send the leg out straight, so you're opening the joint, and then slowly bending it as far back as it's comfortable to go. It might be all the way up here, and then you're going to glide it forward again. So you're opening and bending this knee joint. So for our rotation, what we're going to do is we're going to sit on a chair, feet flat on the floor with our knees at a right angle. We're going to have something in between our knees just to make sure that they stay hip width apart during this. They don't collapse in. I've got a block. You could have a block, a rolled up towel, a ball, something similar. And what you're going to do is you're going to just think of these lower leg bones and foot rotating outwards. And then coming back to the middle and seeing if you can actually go inwards a little bit. So if you're going around a clock face, you're going 1, 2, 3 o'clock, 3, 2, 1, 11, 10. Don't think you quite get to 9 on the internal. You might find it easier to have something like a sock or a flannel on the floor if you've got a slippery floor like this, and you can use that to help glide around. But do be mindful that you want to keep your heel underneath your leg so you're not ending up with a tilt on the leg here. This is just the simple rotational movement that we're trying here. And if you really want to give the body a challenge, you can step that foot. It's going to still be hip width apart, a natural foot step forward, and keeping that upper body stacked over the pelvis again, you're going to let the knee come forward, and then you're going to rotate your body in towards that leg, that back leg. And you can see I'm getting rotation and bending in the knee now. And then I'm going to rotate back to the front, straighten the leg. So it's bend, rotate. I'm coming over my big toe, and then rotating back to the front and straightening. And that way you're experiencing that flexion and the rotation at the same time with load through the body. You've got your body weight through loading into your foot and your knee. So that was Movement Monday of the knee. This is Pedro, who wanted to get involved in the video, but he says that now you know the moves that the knee makes in 2 different planes of motion. You know some practices that you can use to get those movements back into the body, and also that if done safely and correctly, there is no bad movement in the body. There are only new movements. So knees over toes, give it a go as long as you do it safely and controlled, and see what range of motion you can access. Don't forget to follow, like, so you don't miss next week's Movement Monday, and you can refer back to this video next time you want to give those knees a bit more movement.